the Vision Zero Safety Action Plan. Kept the agenda to this today. Mostly because we have a meeting at 3 in our conference room, and so we need to make sure that we're out of here, completely out of here in time for them to be setting up. So that. You should be seeing the presentation.
No presentation.
Nope.
You're sharing.
There we go.
You? Are you okay? Yep.
Thank you. On behalf of the project team, I'm Alex Cohen, with Cambridge Systematics. Joining me is Matthew Rowe with Stantec. We also have Corey Hopwood on the line as well. Sure. Are you guys still seeing the presentation?
Yes.
Thanks for.
The Apple 11 from there to go full screen.
Thank you, everyone. For today's meeting, we want to go over some results of some systemic safety analysis. Also discuss some proposed treatments, physical treatments in there. Matthew's going to discuss how our ongoing effort for conducting investigations across 40 facilities in our region is going. We also have some discussion items too, kind of continuing on our previous discussion of policy and process changes. Weaved in with that too. We'll talk about some of our Vision Zero target setting as well as provide some update as well. Systemic screening, just to take a step back, is really in safety plan, we really have our two sets of crash analysis. The first is really, which we've shown quite a bit of, is looking at hotspots. So looking at those particularly discrete locations, segments, and intersections that are overrepresented for crashes, that have that historical pattern of them. But by looking at, conversely, systemic screening is more of a risk-based approach. So this is looking at generally where crashes are occurring throughout the network, finding those focused facility types, and then seeing, other roads that have those characteristics where those crashes may occur. So we can be, so whereas in the hotspot screening, we're reacting and deploying countermeasures to where crashes have occurred. But in this case, we're looking, finding locations that are sites with promise, those locations that can reduce the risk of potential crashes, particularly those that are fatal and severe injury. The first step for us is to identify focused crash types. So for this process, we really looked at those crash types, those emphasis areas that are related to really infrastructure locations. So intersections, roadway departures, crashes, they're speed related, and pedestrians. So today we're going to show some of the focus on facility types, talk a little bit about how we're doing the risk factors as well, and then we will show some of the systemic treatment packages that we're currently developing. Um. So we should just a few of these slides, but just, so really for the focus facilities, what we wanted to do, really highlight those location types that had the highest average number of KA being fatal and severe injury crashes per, on average, each of those locations. Or maybe some location facility types too, where we do see them being a large share of the overall number of fatal and severe injury crashes as well too. Just so that we narrow down, so that we have through the intent of the focus facilities, those strategic areas that we can say, hey, there's 671 signalized cross and four-way intersections. That winnows it down out of the thousands that are within the regional law. And furthermore, then with the risk factors, then we begin to prioritize those even further. So we begin to have kind of a cost-effective strategy for types of improvements. And so through each of these, we have both urban and rural locations. So we want to make sure that we have identifying locations where treatment packages can be useful, throughout the whole region. For pedestrians, the majority of pedestrian crashes are happening at intersections and within the urbanized area, urban areas. So not just the Albany, but Saratoga Springs, Schenectady, and even some of our small urban areas as well. So we've looked at kind of the geometry type, the signalization, or whether they're stop controllers as well too. So really for pedestrians, we're looking at these urban intersections. And as we see through a couple with both intersections and overall general intersection crashes and pedestrians, there are some locations that overlap. So that allows us to really layer on different treatment packages to help mitigate all sorts of crashes. Next up, we have roadway departure, those run off the road crashes. This is where rural facilities are of particular focus. I think I had an issue with that. Oh, sorry, I have a duplicate column to the right there. So we have, these are, so we're looking at rural arterials and major collectors as well. So that should not be 624 KA crashes per mile. We have 0.212 KA crashes per month. And then for speed related, we're both in the urban and rural context as well. So although not as much as some of the roadway departure crashes, since speed related crashes are based upon what's in the crash reports themselves. We do, there is a lot of overlap to those locations, and that can have some mutually supportive treatment packages as well. Any questions on these focus facilities so far?
I guess one question just for clarification with the percent columns, those are percents of this category. It says total.
Yes, yeah, of crashes that are happening of overall speed related crashes. So if we're looking to address this subset of crashes, we particularly want to look at urban arterials. Not surprisingly. Certainly more predominant than maybe than rural ones.
I have a question. And does urban include what we would conventionally term suburban? Because there's only an urban rural category.
Yes, so, though. Most of suburban, so those that areas are part of the census designated urbanized areas, so that have the. Which is kind of clipped onto the roadway network for the function of classification. system. So, what we're undertaking now too is identifying the risk factors. So within these focus facilities, we're doing risk factor analysis within these attributes that are available, through the roadway inventory system data. As well as a few other ones that we have, for pedestrians as well, doing some. Looking at, high-risk areas as defined by the Vulnerable Road User Safety Assessment, and pedestrian trips. We are taking a look at, so that we can identify not just those focus facilities, but kind of seeing. So what we can do is identify those risk factors that exceed, where the percentage of fatal and severe injury crashes exceeds that share of, in this case, rural minor collectors with narrow shoulders. May not be a pure correlation, but really understanding, where we're seeing, a greater preponderance. And we decided to go at least like 110%, just so that there's really see those areas where, is that a potential risk factor? We do see some areas with like pedestrians, for example, that push button activated, or intersections with pedestrian signals may have more crashes, but it gives, it's, it does give us, there are some that, there's some thought to areas that could see improvements as well as not just the haves and the have-nots of, what you consider to be safety treatments.
And maybe you're gonna touch on this. I know early on we discussed even those that have the crosswalks and push buttons. There's ones I can list here that still don't work. So like I don't know if it's within the scope of this project to also be trying to identify what intersections have push button crosswalks, which ones are actually not working.
So you mean like it's the intersection isn't working well, or the push button itself?
The push button itself is not working, so people get this either false sense of security or they know, oh, that thing never works, so I'm just not gonna even hit the button. I just wasn't sure if it's within the scope of this to try to identify across the network what is working.
Yeah, and unfortunately, what we have in the inventory of, what's present or not. So I mean, really, want to tip our hat to, NISDOT for actually having an intersection inventory, something that's not federally required. But, it's been helpful with crash, it enables crash analysis.
Maybe is a recommendation or mention in the report, could be in the future, taking that inventory and then having either the local municipality or someone going back and saying, hey, can you check? See if these are actually functioning and create a roadmap to repair, replace. Well.
Any other, questions? I know we're trying to work on showing how we kind of boil down some areas, to some particular targets. Or, anyone online? Next, talking about some of the systemic treatment packages, so. Okay, great, Alex, you found me 500 intersections, you found me, what can we do? So what we want to do is take a look at, really having packages of projects, so really some, compiled, sets of measures that are, based upon NISDOT approved countermeasures and some of their, systemic safety plans. And because we're seeing this work, continue to evolve in New York State. It's really growing. But we don't have an overall compendium yet. So, that's something we think is really important for everyone around, the table here today and online, to really give folks a little more clear direction of what's eligible, what we can do, and where best to put it. So much of our safety planning process for years has been focused on hotspots. So, Robbie's going to a location as part of a site visit, like, there's only a few crashes here. There's nothing we can do about it. Like, no, there's things that we can do perhaps proactively and really steering and providing that context if we go out to a road in Colony. And, is it a road departure issue? Is it a pedestrian issue? Is it a speed issue? So really, then helping to connect the dots more effectively, to those safety treatments that are available. There's an ever-growing list of them, and it would be useful to all of us if, hey, here's 200 pages of fact sheets of countermeasures. We didn't say where to best put them. So we want to help steer, kind of have that roadmap together. And in that way, our packages are really grouped by a number of different ways. But it's by focus facility, eligibility, and are the type of countermeasures and their compatibility together. It's really our hope to allow project sponsors to come up with a package of a group of 20 intersections. We've seen that recently with the pedestrian safety action plan. We're going to be seeing that again with upcoming funding through the vulnerable road user safety. With the roadway departure safety action plan. We'll be expecting some funds from that as that soon. So we want other folks to be able to take that approach too with other HSIP funds or to work into their own capital improvement programs. I do just want to note too that these individual locations, even though we've identified these focuses, they still will require some field evaluation. But I think we're really kind of helping steer you in the right direction of identifying that. And we've also identified some enhanced packages too. And we're also noticing some noting where there's additional warrants or considerations that may be needed for those. We're also noting work flying into their FHWA proven safety countermeasures. I just have a few of these right here. These are increasingly being HSIP, Highway Safety Improvement Program eligible. And they have considerations, good resources to kind of help explain where best to apply them. So we're denoting in the following tables which of these are proven safety countermeasures. So we'll send along this whole package here. I don't want to go through every check box, but to kind of explain a bit of the logic, bit of the direction we're going, and hope to see if this is as germane as folks as it can be. So for package A, under intersections, looking at signalized locations where we see then our regional focus facilities. And just a number of countermeasures that could be considered together, some signage, some markings, back plates, things that together have an aggregate crash reduction factor that is quite significant. Then under 1A, looking at potential enhanced options as well. Raised crosswalks, overhead blankout signs. So one in Schenectady on one of our recent road safety audits. It's quite impressive. Restricting parking, particularly at intersections. So these are just some of the recommendations, countermeasures that are part of the pedestrian safety action plan, looking at applying that to all intersections. And these are quite in line with FHWA improvement safety countermeasures. So some of this can be, some of these could be done individually, some of these could be done through maintenance projects. Or these could be an overall broader capital project. To do a whole group of these as well. If anyone has any questions, feel free to jump in anytime. Secondly, looking at stop controlled intersections. With really an emphasis here on our rural stop controlled intersections. Package B is really a series of low cost countermeasures, signage, markings, but whose demonstrated crash factor is reduction factor is 10-15% each. So really adding them together. And being done maybe systematically throughout an entire county has the potential to, support a dramatic decrease and fatal and severe injury crashes. Then enhanced options too, maybe some of these might need a little bit. When I look at some areas that have had some observed crashes, but spending the extra dollars on flashing beacons and lighting as well. So in a case like this, the enhancement would be in addition to the work that's there. It would be in the primary package. Roadway departure. The recently approved roadway departure safety action plan has had a series of recommended countermeasures. And so we've laid those. So kind of each of the packages is really based on the certain eligibilities that are included in that plan. First is really a series of signs and markings. Particularly looking on where we have curves on a good number of roads, maybe excluding some local roads as well. We know not everyone has a curve inventory. That's something that can be a little bit developed over time, but if there's areas where people have horizontal curves, these are great things to look at and to do. And a lot of our facility owners know where their curves are anyways. They're looking at some enhanced options too, larger signs, more retro reflectivity. These will be eligible as well. Then the third one, related to particularly corridor projects. So if looking at a singular corridor, whether there's a number of projects you may want to look at on a windy rural road. Or at a series of roads in the area. So they denote a couple of their risk factors in the roadway departure safety action plan. That's similar to the ones we have with us. Higher speeds, narrow shoulders, curve radii, which we don't have, but looking at particularly shoulders and speeds are really would be two key areas that we can look at for prioritizing projects.
See the reference to MUTCD 2009. Has New York State adopted the most recent version, and would there be things that we could pull?
They have not yet, and I think looking between, I was kind of flipping between 2024 and 2009. I didn't on the surface see any big difference between at least these sections.
Yeah, there might not have been any updates to that. NISDOT they're sort of in the middle of adoption. They've said it is what you should use, and they haven't updated necessarily any of their specific protocols. But yeah,
I think it's probably less of a topic of conversation than if we were at the Active Transportation Advisory Committee. Probably a lot more.
There's a lot more
sharp and pencil discussion there. High friction surface treatments. And I just want to note this is one case where it does require a benefit cost analysis. And then lastly, audible delineators, both along the center line for reducing, head-on collisions or, on the edge lines for lane departures as well. Those are actually, NISDOT's first, approved systemic countermeasures. I was in a couple of, memos from a number of years ago. So, I mean, across the way here, there are a lot of different options that can be pieced together, so as we send this out, we really want to get feedback on which, if there are some that jurisdictions have done already, have had issues with, you want to mix and match other way, packages, you know, countermeasures and packages, it'd be great to know. Pedestrians, building upon the pedestrian safety action plan, so this is one where we thought about looking at, you know, how our packages really delivered, so signages and markings being maybe one contract, signals being another, maybe. If folks have done, you know, different delivery methods, that'd be good to know. Also looking at uncontrolled marked crosswalks as well. Particularly where maybe like secondary approaches do not have. Where there's actually, we have from secondary approaches across Main Street, so there's not, you know, a stop sign for that. So some upgrades that can be done together, or then, you know, some ways of looking at prioritizing enhanced packages as well too. So looking at those rectangular flashing beacons, building median refuge islands, or looking at even pedestrian hybrid beacons. So really doing those upgrades to enhance those crossing locations. Lastly, the vulnerable user safety road assessment does give additional eligibility for those countermeasures that are in vulnerable road user high risk areas. I know we had some in Albany, Schenectady, at least they're part of the plan. We will share the map with that. The plan itself wasn't that detailed. Well, so the recommendation, it was verbal, it said to construct, you know, bike path countermeasures in high risk areas. So kind of working a little bit with NISDOT, main office, we were able to come up with some of these ideas. So recognizing existing countermeasures, putting countermeasures near public transportation stops, including lighting. That was a specific goal for it. And even constructing new facilities where none currently exist. So some new opportunities presented by the Vulnerable User Safety Assessment. Lastly, speed related. Couple of these may not necessarily be fully HSIP eligible, and we'll probably want to note that as well. But we think these are a couple. These are two countermeasures that have great potential. You know, doing speed feedback signs, particularly in approaches of reduced speeds such as school zones, and helping to spread the word more about road guides and kind of putting that into more further guidance. You know, NISDOT's own guidance says 15,000 vehicles or less a day. That could be maybe considered lower as well. So those are the 19 preliminary packages that we have right now. We will send that out following the meeting, but if anyone else has any questions, comments, maybe suggestions? Floor is open.
the status of this is that this is a draft or,
Yeah,
so it's good for people to have comments.
Yeah, I mean, but this is the first time I think the
Right.
group is seeing it,
Yeah.
so they haven't had time to formulate questions.
sure. Yeah, I just wanted to be able to walk through kind of some of the logic of where it is, how it's organized and will. And we're happy to get any comments anyway, whether like the organization, whether they have issues with any of the countermeasures. Discussions about, where best to put them. Really appreciate any of your experience and guidance.
Just to be clear, the end goal here is to take all of the hotspot or systemic analysis of the proactive approach to where there might be dangerous intersections or roadways. And then have a list by maybe municipality along with the recommended packages. Is that
Yeah, you're helping to connect the dots of, which packages would be good at those locations by knowing the focus facilities. Have, location maps that sort of show 1, 2, 3 risk factors. And then being able to tie the focus facility, these packages back to those maps.
So it wouldn't be, it's not gonna be like a list, it's not gonna be like, at intersection A. Do these exact treatments, it's more that at intersections A, B, C, and D. There are a number of things that you should consider that might be applicable.
Yeah,
And that could presumably get funded.
yeah, we'd certainly want to. I mean, thankfully, New York State has been making a lot of pushing that way. But. Yeah, so Robert, we'll think about how we can do to kind of cross-reference those as much as we can do it. But I think that really kind of hopefully narrows the window of, okay, here's some of the locations, here's some, it's maybe not paint by numbers, but paint by a few numbers. That's what
Hey,
we
Alex,
have.
quickly, would it be possible to get maybe a general cost for each package, or even like a menu of options for where to get funding for it, whether it's federal highway, DOT, whatnot? I'm just picturing sharing with council and then asking, how do you pay for it and who's paying for it as the first question.
Sure, we will add the funding column on here, because I think probably, highway safety improvement programs eligible. We can always use broader surface transportation block grant funds for safety projects. That meet the requirements of safety programs. Or if there are some that are like speed feedback signs, that maybe local funds, GTSC does have some, maybe some of their police traffic services funding. So primarily highway safety improvement program funds, but we will denote those others as well.
Thank you. I appreciate that. Yeah, I'm picturing that being the first question.
Yeah, kind of the genesis of the thought process was on the highway safety improvement program funds. Kind of coalescing all of this growing body of work, but other great ideas that do meet these, that are within these focus crash groups that and speed feedback signs, road diets and other, traffic calming that's not exactly safety eligible.
Much appreciated. Yeah, the cost sometimes will equal if it's going to be short, mid, or long term for us. So it's good to know. Thanks.
would SS4, the next 2 rounds of funding for implementation, be able to use the safety action plan and allow that local government entity to say, okay, these are within our jurisdiction. We should apply for the $2 to $3 billion of local money to fix some of these.
Yeah, and there's probably been, that kind of does meet the spirit or kind of the flavor of a lot of the grantees. Some have been, okay, here's our champion corridor, here's the Main Street revitalization and safety project. Or a lot of have been, we've identified aggregate safety and accessibility needs at 40 intersections. That's another approach as well. I know the NFTA in Buffalo is kind of looking at a package of intersections in that way. So this, these systemic treatment packages as well as other improvements kind of layered together. That's also another kind of route to coming about to creating an SS40 project.
I believe the 4th round of the 5 rounds of funding is either due or due to be released in March. For others on the phone that maybe haven't been as aware of the implementation funding opportunity.
Right, once you've got a plan, you can apply for the implementation funds.
Which from what I understand could be up to 10 times the amount of funding than what was in this, I call it phase 1, but the safety action plan funding,
Yeah,
much larger column.
possibly more competitive, but larger. Possibly.
Any other questions?
So, hi everyone, Matthew Rowe at Stantec. I'm just going to talk about the street safety investigations a little bit. We've been calling them highway safety investigations, but most of the locations are streets. So we'll call them street and highway. Thank you. Okay. So as part of Vision Zero Action Plan, we've been going to 40 locations. It's really more intersections than that. Some of them are corridors, but doing these inspections, and I'll talk a little bit about what they are. It was just a photo from one of our site visits earlier in the year. Each of these investigations is going to have a short report. It'll probably look a lot like the slides you're seeing today. It'll have a summary, it'll have a location map, it'll have a crash history. It might have a summary and a separate spreadsheet from the NISDOT crash database of crashes at that location. And it'll have a summary of pedestrian, bicycle, and other geometric conditions. Site photos will be included in these, and there'll be some relatively simple recommendations. And oh yeah, here's my cute little, it didn't quite translate, but I was crossing out highway and writing street here. So I just want, rather than kind of belabor one particular site, we've done a lot of the site visit investigations. We're pulling the crash data now, and then we'll review them together and do recommendations. But I want to talk about some of the conditions that we've seen more generally, because we have done quite a number of these now, and there are things that repeatedly come up across the region. So this isn't about a particular site, this is about regional issues. Broken or missing sidewalks are common. We know this, but this is some documentation of just how widespread that problem is. Even when there are sidewalks, there are heaving issues and settling that have created gaps, and there are accessibility issues related to that. Inaccessibly narrow sidewalks, even when they're there, and this is sort of a combination of bad condition and narrowness that you're seeing here. And something that we just keep seeing overall is problems of not enough street lighting. And we hear that from the public, and we've seen it in the street. Inaccessible sidewalks lead to people having to walk in the street. This is a family with one of its members using a personal mobility device. They had to walk from the corner to, I believe they were going to a car, but they had to do that in the street exposed to motor vehicle traffic. On a street that was a subject to one of these investigations, which means that it was already prioritized, it already had severe injury crashes in its crash history. At intersections, we see a couple of issues recurring. One is that, besides the very obvious, there are a couple of things in this image the obvious missing detectable warning surface, and sometimes just deterioration. This is a particularly extreme one. But also, I just want to call attention to the long crossing distance here. And that there's really, there are a lot of streets in the region that have opportunities for shortening crossing distances. And that can have some benefits for signal phasing and timing, because you don't need quite as much time to get across the street. You can have shorter signal cycles potentially, if that's done more systematically. Missing accessible pedestrian signals are pretty common, and again, street lighting issue. I want to touch very briefly on bicycling and micromobility infrastructure. There's very little of it at any of the sites that we investigated, but some sites have excess capacity. Either the roadway itself is wider than necessary for the number of lanes that it has, or meaning the lanes themselves are wider than standard, or there are multiple lanes. In most cases, it's simply a little bit of excess room here and there. Can it add up to bicycle facilities? In some cases, yes. In some cases, no. But suffice to say, there isn't really a bike network, even in terms of marked routes or signed routes in most of the cities that we are investigating. And lastly, just kind of other geometric conditions. Sometimes we get to a site and we say, oh, it's kind of obvious what you could do if you had the resources to do it. And sometimes it's less obvious, but when there's an irregular geometry, there are often opportunities for shortening crossing distances, for tightening up the intersection, reduce the speed that motor vehicles make their turns at, and improve the yielding compliance. That kind of potential for street redesign is not at every single location, but when it's there, we're noting it. And another kind of grab bag issue is that it's pretty common for sidewalks to be interrupted by driveways in this region, rather than for driveways to go across the sidewalk and for the sidewalk to continue. So that's something that is a matter that cities and towns should really be considering in their building codes as well as in their street design. But it's something that can be corrected systemically if there's a project like a multi-use trail project, like converting a sidewalk to multi-use trail, things like that. You can spend that money to correct that issue. Some of the just maps to show how these sites were selected. They overlap substantially with the equity priority areas that have been established for the region. And there's at any rate, we've selected the sites based primarily on their crash history. All of them had severe injury or fatal crashes, and many of them were in the highest category of severe injury or fatal crashes. To show some priority areas as the Colony, Waterloo Beach, Troy, and Green Island, and Schenectady, Saratoga Springs. I'm not going to dwell on each of these, but if there are questions, any other comments about prioritization? I kind of lost it.
No, I mean, we really hope that, really hand it to, the Transportation Council for including investigations as part of the project. Hopefully it's really part of that missing step, and we'll talk about this in some of our process changes, but is really being, part of an annual set of investigations. That's like the number one policy and process change I think we recommend. We're recommending to other partners everywhere too. It's we want to go after, it's really tough. There's no way we can create like a simple logic tree. Okay, if you have X, Y, and Z crashes, or you're this, therefore do these countermeasures. You just have to go out there and walk the corridors, see the intersections, observe the conditions at first. And talking about, bringing in feedback as well for whether it's facility owners or other partnerships.
And I'll add one thing, which is that, I do a lot of safety work, a lot of street redesign work. And sometimes it's really hard to get those projects done. Sometimes there are complexities and trade-offs, but in a lot of the cases that we've seen and documented so far, there's a lot that can be done simply with more resources. And that's meaning the right of way is already there in a lot of cases. The facility is in theory there, but is deteriorated. It could be a result of property owners not having the resources to maintain them, or the city is not being able to get the property owners to do that. And that's something that, it's not limited to one town or one city. It's really a systemic issue.
So we're running the crash analysis now, the
Okay.
detailed review of each of the locations, so more than the number screening, delving into that now.
Yeah. So there'll be more specifics for each location, and there'll be, a short report for each. But hopefully that'll allow you, as facility owners, to go and apply for funds to do something about this.
But overall, seeing a lot of systemic needs, seeing a lot of, things that we may recommend treatment packages, looking at overall maintenance issues.
And I didn't talk too much about this, but accessible pedestrian signals are required in the new manual and uniform traffic control devices. That's something that nationwide, everyone's gonna have to kind of gradually deal with, the installation. But that's an opportunity to upgrade signal infrastructure. It's an opportunity to reconsider signal phasing. It's an opportunity to implement leading pedestrian intervals and other things like that. So when you're doing these kinds of changes, when you're doing the work to meet the letter of the law on accessibility, you have this opportunity to take a look at the intersections that you're working on and say, okay, well, we could do more. Possibly within the same project. I'll give a shout out also to one of the FHWA countermeasures, which is pedestrian refuge islands. And the reason I mentioned those specifically is just that we do have a lot of roadways in this region that have either two-way left turn lanes or have relatively wide one lane each direction streets, and that have the space for that kind of treatment that has multiple benefits, both for pedestrians and to moderate vehicle turn speeds. So that's all I have.
I have one comment
Yeah.
question. Is there any consideration for integration of street trees with that type of pedestrian?
Yes, actually, a lot of cities that build pedestrian islands also install street trees on them.
There's guidance on width, so it's not a hazardous fixed object.
Correct. And they're so, policy practice. I'll turn it back to Alex unless there are questions.
Okay, some remaining time, I'd like to talk about some policy and process changes. Just a couple of slides. I mean, we showed a few of these last time. We want to provide a little bit of context of where we're throwing around a lot of P words. First of all, really discussing kind of where some of the birds and the bees of it all. Really emanating from our Vision Zero policy, some of the process areas that we're going to discuss together. So how we're coming up with safety projects, how we're supporting different initiatives, how we're collaborating on programs. And lastly, those aforementioned projects and programs, those that will be putting into a subsequent chapter on the safety improvement program. really bringing together our projects and programs in kind of an overall broader, combined funding list. Last time we discussed some of the best practices we've seen nationally, and in New York State. And really throughout all these, we're really trying to make sure that we, target everywhere across the 5, key elements of the safe system approach. Safe roads, safe road users, safe speeds. And post-crash care. First, I should go ahead. Actually, no. Sorry. I know one thing we wanted to do is talk about targets today, so, we have shown through some of our trend analysis, of where we're going, and really as part of the long range plan too. It's a great time to have this conversation. So setting a Vision Zero target, we're seeing an increasingly number of these happening throughout the state, whether it's peer plans going right now, or some other cities doing the work as well. So some of the NPOs, is Tompkins County and GBRTC in Buffalo have looked at the overall plan horizon. And others have really taken to heart the 0 fatalities target as well. Knowing that really the safe system approach is about eliminating fatalities, in turn and reducing the severity of crashes. Really kind of a recognition that serious injury crashes may be a tougher hit. So we've looked at some of our analysis here that maybe 50% reduction in serious injuries could be done as well. We really haven't. We've brought this topic up kind of on and off, touched on it a couple of times initially and through some analysis, reviewing some analysis. But we just wanted to see if there's any, as we continue to talk about creating a Vision Zero policy, we just want to make sure that as being kind of the governing document, that we have some general agreement on the overall target and format.
Hey, guys, so this Vision Zero target here, is this in addition to what their MPOs did? Aren't we doing something like this as an MPO, Carrie? Or as a state?
So,
Sorry, we just adopted the NISTOD's targets.
yes,
Should have updated that at our last planning committee meeting.
Chris, great question. So to put all of these into alignment, New York State does have a goal of eliminating fatalities and serious injuries by no date in particular. So we can build upon that for sure. So really kind of using maybe the metropolitan plan, planning horizon adds a little more clarity and teeth to that. Then those highway safety improvement plan targets are really about near-term performance management, and those will continue to be an ongoing process. But having this long-term target as well provides a contrast to really see how are we doing, not just are we going up or down 1 or 2%, but really keeping that larger target in our field of vision. So they all work together.
So I just didn't know, so when the city of Syracuse came out 2023 and they adopted this resolution, did they adopt it with a funding stream or with a plan in mind that what they're gonna do? Because anybody can adopt anything, but it would open the municipality up to something, you know, where you said, okay, we adopted this resolution and we're going to pledge ourselves to eliminate traffic fatalities. And then what? Like, so did they actually have a funded plan and very similar to what you have here, these countermeasures to how they're going to do things?
City of Syracuse is doing a plan right now. You go to Buffalo Niagara MPO. That was kind of, by having that target, that's why how they agreed to go forth and do the plan themselves too. Tompkins County, they're in the midst of a plan.
Yeah, cause you sent me that email yesterday about the city reduction of speed limits. And we are moving forward with that. It would actually be taken up at the next cycle, which starts Monday and then the following Monday. So in two Mondays, we could actually have that adopted. But, there was already, it's not even adopted, and there's already an article in the Gazette saying, yeah, you did 25 mile per hour, but now what? Now you gotta do more than that. You have, you know what I mean? And that's where I want to make, because you kind of set yourself up for that. So that's why I just want to make sure, like, I like the idea of doing it with the MPO and all that. I know it's a little vague, but if you do it as a municipality, you better have your act together, and you got to have the PD on board, and you got to have everybody on board as a city. That's where so I didn't know what those two cities, New York City's its own animal, but I didn't know what those two cities actually did to put their money where their mouth is.
Yeah, I mean, it's really, it's certainly the vision, and it drives home the need to be doing these multi-pronged strategies. It's really an emphasis, a strong emphasis by the governing boards to adopt, and that's part of the reason too, is that as we adopt these plans, do we adopt the target with it as well? Because it's really a statement of intent by our governing bodies to really actively pursue all of these recommendations that we have. We can't totally project if they're going to do, that we're going to reduce crashes 75, 80, 90%, but trying to keep everything within that target. Oh, so we have one question from Andrew with NISDOC. Andrew, you're muted.
Can you hear me now?
Yeah.
Oh, okay. Yeah, I just want to add, that was a good question there, Chris. If the local municipalities can do this, the way FHWA kind of says it is, they have the Towards Zero Deaths, Vision Zero, whatever, their branding of it. And then they say the safe system approach is how you're going to get there. So if you're needing to pull in all those other people, in the city, it might help to kind of assign them kind of roles within that safe system approach, safe drivers, safe roads, safe pedestrians, whatever they kind of the terms they use. And then FHWA says HSIP, the HSIP program is how we get there. So that's the funding really for it, I think. And I think if if you follow that HSM kind of HSIP process, that's the story you can tell. This is our vision, this is how we're getting there, and then you have the tools to kind of show progress along the way.
Just to follow through
That's
on
my
Chris's question though, because you're familiar with Rochester, I know. So when Rochester did theirs, did they allocate funding or do something else? Like concrete?
Yeah, their planning process was a little different. Kind of some inside baseball there. But it's really become a priority in their capital planning process. It's been for Rochester, they've, taken up, they have 10 key strategies, and that's really something that they hold as part of their process. And so for us, really, how are we getting there? It's through through that kind of that diagram showing from the policy. So having from that policy, here are the processes that we're working internally with our agencies through those. These are collaborative processes too. So how we're working together to then implement and support those projects and programs that are going to be directly improving safety on our roadways in the region.
So this is Chris again. So what it sounds like then is, this is the difference between planning to do something and doing something, the planner and the engineer here, is that, you know, the city of Schenectady or any city, like we're doing our comprehensive plan, we could put into the comprehensive plan that the city wants a vision of zero traffic fatalities and serious injuries from traffic, and we will move forward in that policy, like with our applications and things in the future to get to that goal. But it'll be a general broad statement, like the police saying is that we don't want anybody to get killed in the city regardless. You know, like murders down to zero, you know, so it's just, it's more of a political statement. It's a statement to get out there. It's something to grab the attention, but you're still going through the process. It's not like when I go to a tip application, I'm looking to do something that makes the roads more dangerous, you know, so it's more of a statement, right? I would view it as that if you were really gonna come out and say this independently and say the city of Schenectady was going to do something like this, that I would have a request to say that I'd like to allocate $100,000 for the next 10 years on these 12 intersections, and it'd be an actual plan, not just a statement. So, you know, and if the MPO does it, then we're all kind of under the umbrella of the MPO, and it doesn't look as it. I get it. It just sounds like a statement to make. It's a nice statement to make, but it sounds like a statement that you make.
Absolutely, no, it's a statement that that is committed to, something that it's by having that target and part of what makes the policy, as part of the policy, is the annual reporting too, that we'll be doing each year. So really, how are we doing, making sure that there is that accountability and that tracking? So that we continue to make some degree of progress, you know, towards that goal.
And Chris, I'll add that if you were considering any SS4A funding opportunities, it is an element of that grant where you need an elected official to come forward with a goal, making a public statement of a goal of zero fatalities on the road, from my understanding of what it was. And I just like the idea that it could bring more stakeholders to the table. For example, yes, police to do safer speeds, planning and design for safer roads. Actually gets paramedics and EMS at the table to talk about post-crash care. The fact that in New York State, we now, the legislation was passed to carry whole blood. We know for every minute that passes where they don't get that transfusion, their chance of mortality goes up 2%. So there are definitely obstacles to overcome at $1,000 per administration of whole blood and the feasibility of a scarce resource. But those conversations may never have happened if it weren't for this joint statement of getting people to the table with a joint purpose of zero road fatalities.
Just to back that up, while for those SS4A funds, this plan does have to include a goal. It doesn't have to be zero, but it does have to be what is considered a significant reduction. They just call them, you know, goals for significant decreases in fatalities and serious injuries in this plan to be eligible for the SS4A implementation grants, which is why Alex is kind of sharing these ones. The goals that were set here were with those implementation grants, especially those latter four, in mind.
Well, it sounds like I'm glad to hear the spirit of zero fatalities. I'm glad we're talking through the policy, Chris, because I mean, one of the things we're going through talking about policies and process is that we really want to make sure that this is really the one policy that we're proposing as part of this plan. We're talking a lot of, that's not to say we're not suggesting a lot of other work and projects that we'll have to do to get there. We just wanted to make sure that that as we provide a Vision Zero resolution template, you know, for local jurisdictions, that this is kind of the overall framework and intent of what we're including. Well, we showed, we talked about some of the best practices last time and kind of working within. I'm a planner, there's always gonna be a diagram. So we wanted to show or how this all is relating together. So really having that vision zero commitment up top, and so. What are we doing, really these topic area, these process areas, within. Really kind of the ROSAC here and some of the partners, around the table. Certainly this maybe can grow as more partners get involved, but really working, in these near-term priorities. So for really, first of all, talking about that policy up top, adopting the policy, designating a Vision Zero coordinator, so who's really that key point of contact. Continuing to support this group, as the key task force. Making sure that the word on Vision Zero, and there's the involvement from other advisory committees as well. Then working with the traffic safety boards and other stakeholder groups as well. There is no common X's and O's, offense, defense formation in any region. So it's an ongoing, cycle of, continuing to work with, reach out to people, but really identifying, these key groups there as well. Then including local jurisdictions, to adopt their Vision Zero resolutions as well.
So I was gonna ask, who designates a Vision Zero coordinator? Or what is that for the region? Is that for individual cities and
Within
towns?
the NPO, but I think we'd also like to have some of those coordinator and task force be part of that as well, too. Point of contact, somebody safe, we want to talk about safety issues, who's really part of the overall regional.
Town A or city B.
Yeah. For complete streets, adopting an NPO complete streets policy statement. As well as, working on top for local model policies. The complete streets design guide is so much of the body of implementing any vision right there, but, working within, model elements, to help. If there's one policy that's sort of similar to this, working with that as well. Within this design guide, working on training, developing, review checklists really as a guidance document, support countermeasures, through FHWA Safe Streets Design Hierarchy. Continuing to support road safety audits, things that we're doing right now, and then coordinating with community partners. So really a lot of these processes are just some of the things that will keep the Vision Zero effort going within each of these areas. And though we haven't spelled out particular individuals here yet, I mean, I think these are really continuing to work with CRTC and working with really everyone here. So these can be done regionally. These are also replicable models that can be done within individual cities as well. Roadway safety management process. Andrew mentioned the highway safety manual. And so there's kind of this overall feedback loop of assessing situations, going out there, diagnosing where they are, selecting, what are we going to do, countermeasure selection. The other few are sort of working through the overall program process, but really in the first three steps, is now that, thanks to NISDOT, this information, these capabilities at such a high analytical level are available. So, making sure that we can share this work, annually. Developing, the term is now annual work program of highway or street safety investigations, and road safety audits, like kind of continuing to do what this plan has done. Developing a community traffic safety team, stealing a phrase from, Monroe County. Really just bringing in other partners within to the, leading into the investigation and RSA process. It's a lot of goodwill, that they've done. They haven't really reinvented any wheel except just put a new label on the website for it. And tremendous outpouring, for that. I'm looking at seed funding, preliminary engineering to develop safety projects. So kind of using some funds. Continuing to periodically update the overall safety inventory improvement program to come. And of course, data development tasks as well. Got to do a great job with active transportation counts, but also sharing project costs, crash modification factors, just looking at also things like curve inventories, just to really support that overall network screening and as well. Robbie, actually, you brought up also pedestrian signals today too, so those sorts of things that can help, really can, support the flow of this whole cycle. If anyone has any questions or comments, please feel free to jump in. I know we get through a lot. We'll also send this out as well too, so folks have questions or want to talk further. Speed management, kind of roll the work that we're doing now into a speed study template. Support with funding and deployment of these speed studies, analyze them, following up. Taking the traffic calming features from the Complete Streets design guide and showing how that could, which ones of those have worked best in different locations. I know people have different luck, feels about different, whether it's speed humps, tabled intersections, things like that, that really, what we can do to share those best practices. Sharing some guidelines on automated enforcement and best practices. That's, as we're seeing this pop up every, increasingly throughout the state, what we can do to make sure that that process goes as smoothly as possible. Maybe even off-road enforcement, you talked about coordination and procurement. And lastly, also the same thing for speed feedback sets as well, knowing that's a particular strong countermeasure too. On the education side, knowing that they're respected, with full respect to the large number of traffic safety boards and what they do as well, but helping to make sure that bringing all of them together as well, so we can take a look at where there are commonalities, and maybe identifying regional gaps in program coverage or future opportunities. Also looking at supporting maybe some peer-to-peer programs, getting Vision Zero out to beyond existing transportation partners. One example is the trucking industry. And also through this other multi-prong of education and public awareness, supporting safe routes to school programs. So through the development of curriculum, support for train the trainers for different organizations that are working within schools, and providing some technical support for those committees that are locally generated.
Can I jump in for
Please do.
a second? Just one thing that can be very helpful in terms of education and public information is that when a city is doing a speed limit reduction, a speed limit change, a citywide speed limit, that's a great opportunity to do public information and to use some of the resources like PTSD grants to actually create a public information campaign directed at drivers to inform them of the new speed limit, and that can be, that can be a positive message, like, it's 25 now, or it's 25 for a reason, or 25 saves lives. It can be something that it's a sort of unusual opportunity in traffic safety education, because instead of it being a thing where we're trying to change ingrained behavior, we are trying to do that, but what we're actually doing is informing the public of something they need to know. And so they're grateful to get that information instead of it sort of, kind of in one ear out the other. So it's a really good opportunity. I really recommend that any city that's doing that, think about using GTSC and other funding sources to do that.
And that great opportunity to think about too, as well as we're doing other. So we can share those practices, we do other countermeasures, yeah.
Yeah.
Actually, I mean, as we do some of our education, really what we want to do is, through the safety improvement program, we'll be identifying the programs and opportunities that are out there. But kind of thinking, what are the processes that, partners around here do to convene and kind of help and strengthen those as well. Funding, particularly, through future tip processes, guide those local jurisdictions, particularly as they're doing hotspot safety projects and promoting systemic treatments. Looking through collaborative funding opportunities to GTSC, or through other, ad hoc partners as well. And continuing to support new funding opportunities that come up. That's SS4A, or if there's other discretionary projects that also funding as well. Local codes, sharing information on high crash locations and corridors, identified through data, through our analysis and public input, sharing that with planning and local zoning boards. We'll also be looking through the systemic safety treatments, particularly in regards to pedestrian facilities, and those, the land use review process is a great time to have that discussion on where, when, and where, how those facilities can be accommodated, maybe provided. So we want to make sure that other systemic safety treatments will bring that information to those groups as well. Lastly, post-crash care. We want to make sure that, really supporting agencies to adopt the track software program. That really helps kind of upstream data flows for everyone. We think a great opportunity to implement some of the Committee on Emergency Medical Services recommendations to improve post-crash care. And really look forward to kind of having a conversation with you maybe after it's too. We're seeing some of the funding opportunities, how we can really talk about that pre-hospital blood transfusion. Knowing that, you've mentioned so much about, how return, responding to, they're not fatalities when you're first responding, and what we can do to continue to do that. And I know that none of us are probably Medicaid experts right now, but what we can look at, how we can start to have that conversation in the region.
What is the second bullet? What are like those recommendations?
So some additional, and Robbie, I've been kind of really building upon some of your grant work on connecting responders to medical data, supporting some of the data response times and kind of access to trauma care.
You briefly mentioned it, but paramedics, I think 40% of those that died from a traumatic injury were alive when the paramedics saw them. It's getting the national data set, the NEMSIS data set, to align with outcomes data. Less than 2% of outcomes actually make it back into the national data set of 40 to 50 million records a year. So that would also help with downstream opportunities for research and areas to find out cause of fatalities. Linking all the data components as well will hopefully help. And then the last bullet there, at least on a capital region basis, there have been 2 meetings discussing pre-hospital whole blood and the initiative and how we have a pathway through the regulatory hurdles to make sure that this scarce resource is deployed in a way that gives access to the areas that need it, and that we identify the funding streams behind and to ultimately fund it.
Great, I'll touch base with you on that.
Yeah.
Anyone else have any comments? I mean, we'll, in our tech memo, we'll flush these out some more. Generally want to emphasize that these are intended to be quite collaborative. And I think that these can have some different arrangements of ad hoc partners working with the council, mirroring, doing these as a parallel process within your jurisdictions as well. Any last comments?
Harry, to answer your question, that FICOM's recommendation was April 20th of 2023, just a 3-page document outlining recommendations at a federal level.
Some updates of what's happening right now. We will have 2 more community concept workshops coming up. Since we finished this up, we are no longer tentative for February 5th in Schenectady and February 26th in Albany. So invites, press releases, all of that should be coming out very soon. We are talking with the traffic safety board in the town of Clifton Park. So if there are any other traffic safety boards, other stakeholder groups that we haven't met with yet, please let us know. Let it come out. In terms of local coordinations, Matthew's talking about street safety investigations, speed limit studies. Congratulations would be premature for Chris in Schenectady, but glad to see that happening. And we are following up with our other communities as well to get those across the finish line and to runs councils. Our active transportation geodatabase we have incorporated all the feedback, and that will be reposted on our website, on our online map for everyone to view again.
And that just as a reminder, we're using that as a reference when we're developing the recommendations for those street safety investigations.
So we have a few minutes left before we are kicked out, before we were left out of the room. Any questions, any other comments anyone wants to share with the group?
So that website, capitalregionvision0.org, and that's where people can kind of crowdsource these intersection safety concerns still, is that?
We still do have an online map up, so on capitalregionvision0.org.
Okay.
We're all set with this. If there's no more comments, I'd like to just provide an opportunity if there's anyone who wants to provide an update, from your municipality or your agency on what you're working on as relates to operations or safety. Well, seeing none, just a reminder, we did schedule an additional one of these meetings for this year, so the next meeting date will be February 27th. And with that, thank you very much for attending. Have a good rest of your day.
Thank you.
Bye.
Thanks, everybody.
Thank you. Bye-bye.